Good evening and welcome again to Montgomery Heart Wellness. And we have another evening. I probably should call these sessions grand rounds. I was looking at the chat comments before coming on, and I noticed several of you commented on, at least two of you commented on having loved ones with dementia diagnosis. And someone mentioned Wendy Williams having a diagnosis of dementia. I wasn't aware of that. I want to share with you today information about dementia, but not just talk about dementia. I want to talk about the diagnosis of dementia and speak from the aspect of whether or not the liver could be involved. Now, the purpose for discussing it in this manner, because we all have probably have heard of a loved one, a friend, or someone who's been diagnosed with dementia, who's lived with dementia. My dad had dementia before he died. And so many of us are very familiar with the diagnosis of dementia. It has a formal set of diagnoses and diagnostics, etc. But what I want to do is share with you how we see dementia in the real world. It's not like you come with a package, the patient walks in and says, "Here, I have dementia," and start treating. It can be a little bit more difficult to figure out whether someone has dementia or not. And I'm going to give you some of that insight. That's number one. Number two, I'm going to share with you how another common disorder, liver disease, can present in a very similar fashion and in many ways can mask itself as dementia. And I want to sort of give you some insight in terms of how you can put these things together. And of course, if you stick with me toward the end, as usual, I'm going to give you some quick tips and some things that you can do on your own to help address that issue. If you're having cognitive decline or memory issues, or a loved one close to you is having the same thing, there's some simple things you can do. So let's get into this very interesting topic. So this whole concept of dementia and how might the liver play a role? And I think this is an important question to ask because we often throw this diagnosis around and oftentimes we don't know what's going on. So what are the common causes of dementia? We know about Alzheimer's disease. Alzheimer's disease is almost used synonymous with dementia. It's thought to be the most common cause, but and again, there's certain pathological findings that are characteristic of Alzheimer's disease, but it's also associated with vascular dementia, meaning that abnormal blood flow to the brain is frequently associated with Alzheimer's disease. And then, of course, you have these Lewy body dementia. Now, again, we have discrete names, discrete classification of dementia. Frequently, these overlap. As I said, Alzheimer's dementia is oftentimes associated with vascular disease. Many people have vascular disease is very common in Western society, the United States in particular. This Lewy body dementia basically have these balloon-like clumps of protein. So similarly, you have beta amyloid protein deposition in Alzheimer's. You have a different type of protein clump. This is a sign of toxic waste, cellular waste, degenerative waste that's building up in the nerve tissue. So although you have these different names, there's oftentimes overlap within the diagnosis of things that are commonly diagnosed as dementia. You can have frontotemporal dementia. So that pertains to a certain breakdown of cells in a certain part of the brain, the frontotemporal part of the brain. The symptoms there are a bit more behavioral and thinking and judgment, as opposed to in some of the earlier ones I mentioned, it's more memory. And of course, you can have a mixture, as I said earlier, and frequently see more of a mixture than we see isolated forms of dementia. And so even within the diagnosis of dementia itself, there's a complexity of abnormalities that you can see in the brain that makes it less clear cut. If you look at the clinical presentation of dementia, first of all, what is it? It's an acquired loss of cognition. So what does that mean? Well, I may forget where I put my keys every now and then. Well, that could be early signs of dementia, or you just may have forgot where you put your keys. You may have brain fog every now and then. So you can have some early signs or signals that may just be, that could overlap with just normal variation in mental relapse. People often say, "Oh, I'm having a senior moment." That's a common phrase, but these so-called senior moments may be early signs of a progressive cognitive decline. And we'll talk about that. And it's often associated with more than one neuropathology, as we talked about before. And again, a clinical syndrome. So dementia, even though we use one term to describe it, it's more of a clinical syndrome. It's a constellation of things that are acting together, and it has variable manifestations clinically. So that can make it very difficult to diagnose it. Someone may come in, they forget things. Somebody may come in to have mood disorders and anger. Somebody may be more quiet when they're usually or jovial. So there are different presentations of dementia, and sometimes it can be very damaging. What do we see in the real world? Well, the initial presentation may go unnoticed. So first of all, we may not see anything. As I said before, senior moments, poor concentration, brain fog, these things can be just thought of as a common, mental lapses that we see. Working long hours. We can have symptoms attributed to life events, stress at work, stress at home. And oftentimes these life events, not getting enough sleep, can have an adverse effect on our mental focus and the like. So again, there's some overlap between what may be normal and what may be an early phase of a progressive neurological disorder. Patients may compensate in certain ways. Like I mentioned earlier, I'm having a senior moment. But if somebody who's noticing that they don't remember things of recent past, may only talk about things in the distant past. They may avoid using names of people because you can't remember the names. Hey, you, Mr. So-and-so. May give you crazy little nicknames just to kind of play it off. Now, other clinical events may mask dementia. So if someone is very ill a lot, they may have had a series of surgeries, may have some hospitalizations. So their mental progressive decline may be masked by the fact that they've had lots of medical treatment. But the most important thing I want to highlight, many patients may get a diagnosis of dementia without significant testing or a finding of an underlying cause. Now, this is really important as it pertains to the discussion we're having today, because you may come in, the doctor see you, and you say, well, my loved one is having some, mental decline. They can't remember things. And the doctor may ask a few other questions and say, well, I think they have dementia or they have Alzheimer's, and they may put you on a prescription drug for that diagnosis. And they say, well, let's get this started so it won't progress. They may not do a lot of tests, or maybe do a few tests, nothing definitive. And so advanced tests, brain tests may not be done. So if you get treatment before a proper diagnosis, that can be problematic. So be on the lookout for that, especially if you have a loved one who just started on some treatment, but they haven't gotten a diagnosis. Let's talk about clinical liver disease. Well, the three major causes of liver disease is alcoholic liver disease. Now, if you know someone who drinks a lot, and they can have one of these spectrums. So if they're drinking and having, alcohol consumption at a large amount over a long period of time, they can have progressive fatty liver development. If they binge over the weekend, this happens with college kids, they may have an acute hepatitis. So you have an acute ingestion, a large ingestion of alcohol, and acute insult to the liver. It becomes inflamed. That's the itis suffix. So alcohol hepatitis is frequently, it's usually reversible. But if you have more and more episodes of these inflammatory insults, then it can progress to cirrhosis. So it's sort of a spectrum where you have fatty liver, which is an early phase of the progressive disorder. You have intermittent acute insults, which is hepatitis, and then you have progression to cirrhosis with alcohol. That's thought to be the most common, but very close to it is fatty liver disease. Now, fatty liver disease is associated with metabolic syndrome, and I would dare say chronic illness in general. So individuals with fatty liver disease have obesity, hyperlipidemia, and diabetes. Now, the reason I want to highlight this is because these people also have vascular disease. So diabetics, people who are obese, people with hyperlipidemia, also have atherosclerosis. And what does atherosclerosis contribute? It contributes to dementia. As I said before, you can have Alzheimer's, but also vascular dementia. So the same person who has the setup for liver disease may also have a setup for vascular disease in the brain. So you can have two disorders progressing at the same time. Now, one disorder may progress faster than the other. So does someone who's a diabetic with atherosclerosis, do they have progression of fatty liver disease and progression of liver dysfunction to a greater extent than they have vascular disease in the brain? So where the liver may be failing, causing some cognitive decline, and we're going to talk about that more in detail, as opposed to the vascular disease in the brain. So you can do, MRIs or CT scans. Well, we don't see any overt vascular abnormalities. There's no history of a stroke. So, well, the brain may be okay. Well, we need to start looking in other places, and the underlying metabolic causes, you need to start to think of the liver. And of course, chronic viral hepatitis. Now, there are many other causes of liver disease. I want to hit some highlights because I don't want to try to do an exhaustive lecture on dementia or liver disease in itself. Now, I did do a talk on fatty liver. So go to the channel, look for the inside skinny on fatty liver. I gave a lot of insight in terms of development of fatty liver and liver disease, which I think is very important to look at. Now, let's look at the liver versus the brain. There are two common problems, okay? So a tale of two common problems. With dementia, you see the population, middle age to older adults. It's associated with multiple chronic illnesses. So people have dementia, may also have diabetes and high blood pressure. They may have had strokes, okay? They may have had heart attacks, they may have heart failure. There's frequent subclinical onset and slow progression. Patients are frequently on multiple medications, with dementia. What do you see with people with liver disease? Well, guess what? Really the same population. Middle-aged, older adults, multiple chronic illnesses, subclinical onset, slow progression, frequently multiple medications used over a period of time. So you see an overlap in the population, you see an overlap in the clinical spectrum, you see an overlap in these two populations. So it's important to realize that that's important to understand, because you're dealing with two potential disease sets, or I should say organ systems, that may be failing together, and there may be an interplay between the two of them. So dementia and liver disease symptoms, inattentiveness, brain fog, and many of you who saw my talk on fatty liver will recognize this slide, because these are also the same clinical presentation of hepatic encephalopathy, which is a form of dementia related to the liver failure. And then you can get all the way to stupor and coma. Now, as you come from least to greatest, a lot of these more advanced symptoms are oftentimes associated with an acute insult. So, for example, let's say somebody has dementia, and maybe they're functioning pretty well. You recognize they're a little bit slower than they usually have been. You may recognize that their memory's not as great, but they can get around and communicate. But all of a sudden, they get a bladder infection. A bladder infection, I've seen old individuals go from talking and doing fine, they get a bladder infection, they can go into like a coma. And you cure the bladder infection, they wake up just like magic. So just an insult such as an infection can have enough of a metabolic insult on the brain, and similarly with liver disease as well. So there's an overlap in the symptoms. What are some of the adverse effects against the brain and liver in combination? Well, poor nutrition, excess animal protein, overly processed foods, sugary beverages, alcohol, excess number of medications. I can't overemphasize this. Medication with liver metabolism, medication directly affecting the brain, medications causing dehydration, anesthesia. Patients may have to have procedures done, maybe have conscious sedation for, a cataract procedure or a dental procedure or whatever. It can, put them in a bad way. And as I mentioned earlier, infections can cause an insult on brain and liver disease as well. So the underlying connection, if you look at this diagram, and many of you saw the fatty liver disease talk, if you see here, we consume food and it gets broken down in the small intestine, and animal protein, which has ammonia products, gets the ammonia gets converted to urea in the liver. So a healthy liver will normally convert ammonia to urea and goes into urine and everything's fine. But as the liver becomes more compromised, then the ammonia does not get converted, and a lot of it stays in the bloodstream and it goes up to the brain. Ammonia can be a direct neurotoxin. So just liver failure by itself can lead to nerve cell damage. These astrocytes become swollen, they release other toxins, and it leads to neuronal damage overall. And so this damage can be reversible, but it can also get to an irreversible point in time. So liver function by itself, mechanistically, can contribute to brain cell damage, which then contributes to a form of cognitive decline, etc. So you have to be aware of this at play because this is a major component. Now just think of this being effective in a normal brain, just how much more damaging it could be in a brain with dementia. So you have to be aware of the connections and the cognitive aspects of it because it's really important to connect the two. Because let's say you have a family member who has dementia and is well diagnosed, the MRIs, the CT scans, but they're on a lot of medications. Let's say, for instance, if you do things in their lifestyle to help reduce the stress on the liver, to help improve their metabolic situation, it takes less strain off the brain. And so there's less insult on the brain that's already compromised. And so the dementia may be less severe just by controlling the metabolic component of things. So keep in mind that that's critical. So what are the possible remedies? I alluded to them just now. One, proper nutrition. I can't overemphasize that. So I've seen lots of patients on my clinical service. They come in and on lots of medication, they have dementia, they have liver dysfunction. We check basic tests to check the liver function, and we start to reduce the processed foods, reduce the animal protein, and in many cases just eliminate it altogether, and have them consume high amounts of raw plant foods, even if they're eating some cooked plant foods. If it's not fried or overly grilled, they can get significant relief. So proper nutrition is first and foremost. And also some superfoods we add like blue green algae, barley grass, wheatgrass. Those superfoods have powerful antioxidants, can be very helpful for both the liver and the brain. You want to minimize medications. Talk to your doctor. Say, doctor, look, we got to minimize the medication list. Doctors are often reluctant, but you got to stay on them. Now, some medication may be necessary, but I'm very aggressive at eliminating medication. You want to wean off medicine directly toxic to the brain or liver. Some medicines, of course, have direct hepatic toxicity. Some, can reduce hydration levels, so have an indirect effect metabolically. And targeted supplements. You can use omega-3. I like plant-based omega-3, chia seeds. You can make a chia seed pudding in some of the foods you eat. N-acetylcholine, milk thistle, turmeric. These are great for liver dysfunction. And of course, advanced regenerative therapies. We use ozone therapy, and lots of our patients reduces inflammation aggressively. Phosphatidylcholine infusion. It also detoxes the liver, the GI tract, and it also helps improving vascular circulation. Exercise, fresh air, sunshine, muscle movement, walking hills, walking in the woods, getting exposure to trees, taking shoes off and grounding, dancing, things that require coordination. I didn't put things like crossword puzzles and things like that that stimulate the brain. Infrared sauna. These things also help with liver function as well as help out with brain function. So you really can't overemphasize a lot of the natural things that can be beneficial. And, it seems like these things are superfluous, but they're very, very powerful. If you look at some of our clinical rounds, and we'll be airing some more of our clinical rounds coming up soon. We've been filming a lot. It's under editing. And you're going to see some remarkable changes in patients with a lot of diseases with some simple things and some with some more complex advanced therapies. But these simple approaches can get you a long way. So I hope that was helpful. I know some of you in the chat talked about having loved ones with dementia, and you can start as soon as tonight or tomorrow to work with them in some of these ways. Get with your doctor, try to help them wean medication, get them on a healthy diet as much as possible. Hydration. You want to hydrate with things like coconut water, hydrating foods, hydrating fruits, cucumbers. Those things are very, very key. All of these things are important in terms of improving overall health. And as you improve overall health, you can start to chip away at these symptoms of dementia. So I hope this was helpful. Please leave your comments in the comment section. Of course, if you're new to the channel, please subscribe and share. And please, please, please give us a thumbs up. This helps the YouTube algorithm get this message across, and many people need to hear about this. So until next time, you guys take care.